Hi everyone! Today I'm going to be talking about the reproductive system, and it's going to be geared more towards infertility among men and women. So what is the reproductive system? It is comprised of internal and external organs in both males and females. It is closely tied to the endocrine and the urinary systems as well. And the main function of the reproductive system is to reproduce life. The reproductive organs can be considered either primary or secondary organs based on their role. The primary ones of either system is called gonads, which are ovaries and testes, and they are responsible for gamete, sperm and egg cell, and hormone production. What is infertility? It is the inability to become pregnant despite frequent unprotected intercourse for at least a year. In the United States, 10 to 15% of couples are infertile. Women who are 35 years old and have been trying to get pregnant for over 6 months are even more so affected. So we see that there is an increased risk for older women. Diagnosis is done through basic infertility evaluation. Diagnosis for women is done through a physical exam, ovulation evaluation, hormone testing, ultrasound to see if there are cysts or fibroids, and x-rays to see if the fallopian tubes are open. Diagnosis for men is done through semen analysis to check sperm count, sperm motility, check shape of sperm, and hormone testing is also done. So the female reproductive system, we have external organs and internal organs. So external organs have a twofold function. They enable sperm to enter the body and to protect the internal organs from infection. They include labia majora, which protects other reproductive structures. Then we have the labia minora, which surround the openings to the vagina and urethra, and lastly the clitoris, which is a small and sensitive protrusion. Then we have the internal organs, which help with the production of female egg cells known as the ova. It is transported to site of fertilization, and then the egg is implanted in the wall of the uterus if it is fertilized. And some of those internal organs are the vagina, which is the canal that joins cervix to the outside of the body. Then we have the uterus, where the fetus develops. Then the ovaries, which are located on either side of the uterus and produce eggs and hormones. Lastly, we have the fallopian tubes, which are narrow tubes that are attached to the upper part of the uterus and serve as tunnels for the ova to travel from. Infertility in women. About 10% of women in the United States, ages 15 to 54, have difficulty getting pregnant or staying pregnant. It is a disorder of the reproductive system that hinders the body's ability to ovulate, conceive, or carry an infant to term. There are a number of causes that range from specific causes to unknown causes. More and more women are waiting to have children over 30, so there is an increase in risk when a woman waits to have children over 30 years of age. This is why this age group is recommended to see a doctor sooner if they are unable to conceive on their own. So what are some of the causes of infertility? I have listed a few. I will not describe each of them, but I will talk about a couple. Ovulation disorders, endometriosis, primary ovarian insufficiency, uterine or cervical abnormalities, polycystic ovary syndrome, cancer, and there are others. So, ovulation disorders affect the release of eggs from the ovaries. These include hormonal disorders such as polycystic ovary syndrome. Endometriosis occurs when endometrial tissue grows outside of the uterus, affecting the function of the ovaries, uterus, and fallopian tubes. Primary ovarian insufficiency, which is also early menopause, happens when the ovaries stop working and menstruation ends before age 40. So what is some of the treatment that women can receive for this. Most women are treated by obstetricians or gynecologists. Endocrinologists treat hormonal disorders. If that is the case, they will see both men and women. Again, I will only touch on some of these treatments. We have intrauterine insemination, ovulation medicine, assisted reproductive technology, in vitro fertilization, and there are many more. And there are also a few medications that I wanted to mention: clomiphene, follicle stimulating hormone, and of course there are others. So we have intrauterine insemination with the use of a small, flexible tube called a catheter. The use of specially washed and prepared sperm is placed directly into the uterus. Then we have ART. With most forms, the sperm and egg are joined in the lab, and the egg is returned to the woman's uterus afterwards. Clomiphene, the medication, it is a medicine that causes ovulation by acting on the pituitary gland, often used in women who have PCOS. Then we have follicle stimulating hormone. It stimulates the development of eggs within the ovaries. Again, these were just some of the treatments women can receive. Alright, so let's move on to the male reproductive system. Most of the male reproductive system is located outside of the body, so I'm only touching on the main organs. The external organs include the penis, where the urethra is located. It transports semen and urine. Then we have the scrotum, which acts as a climate control system for the normal development of sperm. And we have the testicles, which are responsible for making testosterone, the primary male sex hormone, and for producing sperm. And then we have, I just wanted to mention one of the internal organs, the epididymis, which is a long coiled tube that rests on the back side of each testicle, and it transports and stores sperm. The entire male reproductive system is dependent on hormones. So the few men that suffer from infertility due to hormones go to endocrinologists to help them with that. Alright, next we have infertility in men. About 9% of men in reproductive age in the United States have experienced problems regarding infertility. It is a condition in which the male produces no sperm or too few sperm cells, or their sperm cells are abnormal or even die before reaching the egg. So what are some of the causes? Lower absent sperm production, varicocele, hormone disorders, damage related to cancer, and there are others. So varicocele, it is a condition where varicose veins develop around the testes. It is a common cause of infertility in men, and it is usually treatable with surgery. Damage related to cancer, including radiation or chemotherapy. Treatment for cancer can impair sperm production. Alright, so let's look at some of the treatment. Artificial insemination, medicine therapy, surgery are all treatments, and of course there are others. Most men for infertility are treated by urologists. Artificial insemination is a type of treatment. It involves placing large numbers of healthy sperm at the opening of the cervix or directly into the woman's uterus from the male. Then there is medicine therapy. A few infertile men have a hormone problem that can be treated with hormone therapy. Hormone imbalances caused by a problem with the hypothalamus, the pituitary gland, and the testes directly affect the development of sperm. So these are some of the treatments for men. Alright, how does the Latino community feel about infertility? I think that if you are a Hispanic or Latino woman, you kind of know about this and have heard about some of this information. Among all ethnicities and nationalities, the value placed on having children is strong. But there is a shift in the Latino community. I was reading an article that said some couples feel that a marriage without children is a failed marriage. Many childless Latino couples have sought out help with infertility, but a lot of them do face economic barriers. Although we do see more availability to those couples in the States that have knowledge about infertility and different treatments, as opposed to the couples that were raised outside of the States and come here to have children. A lot of those women that were raised here continue to seek treatment until they can no longer have the ability to have children. So another article that I was reading was about this woman whose family said all Latino women are fertile or should be fertile. And this author's grandmother even went as far as saying, hay que ser mujer, meaning if you can't have children, you aren't woman enough, which this is a huge misconception, and I believe it is outdated, but it is still very real to Latino women. And I feel that it affects women more than it does men, although infertility is something that Latino, Hispanic men deal with, but that responsibility is always mainly laid on the women. So it definitely has a great impact on the Latino community. So why should interpreters be familiar with this system, and what are some of the issues that we may see? First of all, interpreters should be well-rounded in knowledge. They should know something about each system, because at one point or another we will be faced with sessions where we will have to interpret for things like the reproductive system, pregnancy, infertility. So I mentioned before that having or not having children is a big deal and means very much to the Latino people. I was reading this really amazing study on the link that you see here about couples, Latino couples, and infertility among them. A lot of them were not aware of their condition. A lot of them didn't understand what infertility meant to them, what was causing infertility. They didn't know what kinds of treatments they could take or go through. So through this particular study, I just see the great need for interpreters that are knowledgeable in the reproductive system, and of course all systems, but this is an issue that arises in the Latino community, which is where most of us are going to be interpreting for. So it is very important for interpreters to know about this topic. Many of the people that went through this study experienced providers who attempted their Spanish and attempted to describe something and attempted to talk to these patients in their native language, but as we all know, there are issues with that. And a lot of these clients felt that they could not ask questions because they felt like they were treated as if they were ignorant, as if they were uneducated, and some of them might have been, but a lot of the times they just felt shame and they felt like they couldn't ask questions, and they really needed an interpreter, and there was not one available to them. So it is very important for us to know about this system, like other systems. But again, I just found this whole topic very interesting. I would love for everyone to go and read this study. It is very, very relatable, and I just think it's full of information that can be applicable to us as interpreters and be useful to us in the future. And here I have my Spanish English terminology. I have a couple of pages on this because I felt like there were many words to be needed, but as you can see, you will be able to recognize a lot of these words. We have learned them in our book this year and our class this year. So here they are. And here is my works cited. I had many sources and I wanted to make sure to include them all. So here is the first slide, and here is the second slide. Alright everyone, I hope you all learned something today, and thank you so much for listening. Have a great rest of the semester.